This is Guillermo Vasquez. He has been an upper cervical care patient for 2.5 years, and he's going to tell you his upper cervical story.
Okay. Before I came in here, from ages 23 through 26, I was suffering. I was in a lot of pain, and some of the things that I had going on was a headache for 3 straight years. I was dizzy for 3 straight years. I had muscle twitches all over my body. I had muscle spasms all over my upper body to the point where I couldn't really turn my neck without going into severe spasm. I had cognitive issues. My cognitive ability just wasn't there. I couldn't think, couldn't conceptualize, had trouble remembering things. I had chronic fatigue. I was always tired. I had insomnia. I could never get any sleep. Depression and anxiety, apathy, and all those things, neuralgia throughout my body.
Guillermo, who did you, once all this started happening, who did you go to see first looking for help?
Well, I first went to the family doctor, and that escalated to going to specialists in every city that I lived in, which was Dallas, Houston, Washington, D.C., L.A. I saw neurologists and orthopedists, psychiatrists,
And what did they tell you?
Well, I got everything from there's nothing wrong with you to could be ALS. They looked for brain tumors. One guy told me it was post-concussion syndrome. Most of the time it was just you're just stressed. And but it didn't matter. It didn't matter what labels they gave me because nothing was being done about it. So eventually I decided that I had to look outside of medicine because medicine wasn't going to do anything. Nothing was changing. It had been 3 years, and it had gotten to the point very early on I knew that I wouldn't have a career or a job or a family, and that the rest of my life, however many years I had left, I knew that I wouldn't lead a long and healthy life. So however long I had left would just be a nightmare. And so I said, I have to figure this out. And luckily, like finding a needle in a haystack, when I looked outside of medicine, the first thing that I found was upper cervical. When I started reading about it, I said, yes, this is it. I'm going to get well. It just made total sense to me based on what medicine had told me and what I felt. And I went in there, I got my first correction, I felt an immediate reaction. The first night, things that I had had since I was a kid cleared up overnight. For the first time in many years, I slept 11 hours straight through the night. Woke up the next morning, saw the sunlight coming through the window. I just sat up in my bed and I just cried. And I knew that I was going to get well. And slowly, over the months, I got my health back. It took a while, but now it's back and I'm feeling great. And upper cervical gave my life back, I can tell you that.
So what would you tell someone that's on the fence and is skeptical and has never heard of upper cervical? What would you tell them to relieve them of their skepticism?
Well, what I would say is to not take anyone's word for it. There's a lot of people who say this isn't science and this doesn't work, but the great thing about upper cervical is that it's so transparent and it's very gentle. That's one of the things for me that I'd never want to go to regular chiropractic because I didn't want to get popped or cracked, and there's nothing like that here. It's very gentle, it's very precise. You can talk to all the patients in the office. When you come in here, you're not going to see sick people coughing with germs, dirty. It's going to be clean. Everybody's happy. Things happen quickly, and you get your health back quickly. And you can see that for yourself. Very gentle correction, very gentle adjustment. And so they're not treating a symptom. It's not a symptom-based. It's based on a principle. Everything else out there I've noticed is based on a symptom and nobody gets well. This is based on getting the body to function the way it's supposed to, and then people get well.
All
So
right.
I encourage everybody to do it.
Thanks, Guillermo.